next, and Senator Annie Hoey, and welcome her back, and welcome you and say it's good to have you back with us.
Thank you very much. If you might forgive me, I'm not in a position to stand terribly well, so I might be up and down just with excitement of coming back, if that's all right.
You can stay seated. Just
yeah, is that okay?
Yeah,
thank you. So I really want to welcome very much that we're here having this discussion today, and that we're seeing this bill coming into the Seanad. I was very proud to be part of the co-signatory group on the legislation we proposed in here, and I don't want to say I'm tickled pink that it's finally coming through, but I mean, this is a really significant piece of legislation. We've waited 5 years for it. And this bill, when we talk about it, is about patient safety and well-being of those who are going into hospitals or healthcare settings, but it's also about the well-being of doctors, GPs, staff, their staff. So we're not just talking about the people who want to access reproductive healthcare, but also their staff. And anyone who I've spoken to, and I've spoken to both those who have sought to access healthcare, but also providers, and they feel, and that those who I've spoken to, and of course I can't speak for all of them, but they really do feel that this will be beneficial, because while we may not have floods and floods and floods of protests outside of places, it does have a chilling effect, and we know it has a chilling effect, and that is what it's designed to do. We know that people have had to make decisions to go in to access reproductive health care, even though they know that there is a protest outside, and particularly has been referenced here in Limerick. And when we think about the reason people need to go and access this very particular kind of healthcare, there isn't a decision that they can well, I'll just wait until next week, I'll wait until another day, I'll hold off until the protesters aren't there. Very often this healthcare is extremely time sensitive because of the legislation that we have. Perhaps for very personal reasons it's time sensitive. People don't have the luxury to say, I'll wait until the protesters are no longer outside. And no one should have to make a healthcare decision based on waiting when protesters aren't going to be outside. That is not the best way to do that. And we know that it can be very frightening and worrying for prospective patients. And I hope that this bill, and I feel that this bill will address the chill effect that these protests are designed to achieve. And I believe that the actions of these protesters are rooted in judgment and not in compassion. And that we have seen this strategy, it's been used for decades in the US, UK and elsewhere in Europe, and I personally cannot comprehend how people feel that they have a right to cause hurt and upset instead of showing care and compassion for fellow people. There are legitimate means, I believe, to express disquiet over abortion in Ireland which do not hurt, impede or insult or upset people as they access necessary healthcare. There's been a previous speaker who referenced a woman who had to walk by small white coffins, and I've also spoken to women who were not actually even going into a hospital, but that they contacted me. And I think I was actually in the chamber at the time, over in my seat, when I got a text message to say, and this woman had walked by a protest and there was a white coffin outside, and she was slightly older, and she said it just brought it flooding back to her. What she had experienced, she had never gone for abortion, she'd never done anything like that, but she had lost a child a long time before that. And she just said to me, she's like, I thought we were in a different place in Ireland. So I think this is going to be really, really important, because it's not just people actually who are trying to access abortion or reproductive health care. There are people who are walking by for whom have lost children, have had very wanted children, and for whom that pregnancy was not viable or did not continue. And this has been an extremely difficult process for them when they see those small white coffins, which are designed to be so incredibly evocative. And I don't believe that they should be used in a way to intimidate, harass or punish people, because I can't even imagine what it's like to have to look at one of those small white coffins because of something that has happened in their lives. And I can't understand how people feel that that is an acceptable, fair, compassionate way to treat people. So I'm very, I really cannot wait for this piece of legislation to get through. I won't necessarily drag on, because I think everything's been said. I was struck by a previous senator saying that this is designed to finish the work the legislation began 5 years ago, and I think that's only too right. This is part of the legislation that was promised 5 years ago. So where we should be finishing exactly. That's how the system works. We say we're going to do some legislation, and then at some point in the subsequent years we get the legislation done. I think that's perfectly right and correct. And I'm glad that we are working towards a situation of finishing the legislation as was promised 5 years ago. And it's been alluded to in this House that there are other pieces that still need to be looked at, the 3-day wait period, the women are still travelling for fatal fetal abnormalities and be forced to travel to the UK. So there's a little bit more to do, but I think it is absolutely right and proper that the Minister for Health is in here today, finishing legislation that was promised to us. I think that's great. I don't know why there's an issue with that. I'm thrilled with it, if I may be so frank about the situation. And I know the Minister is taking this very seriously. And it's my hope that this legislation will give comfort to other providers. And I know we've had discussion about some of the providers, particularly in the Midlands Northwest, who don't feel that they can currently provide access because of whether it's the threat of protests outside, and for whom some of the providers I have spoken to do fear that if they were to be known as providing abortion care in their clinics in some part of rural Ireland, that they will become a target of protests. And that should not again be a reason people decide not to avail of providing healthcare in an area because of fear that that will bring upon them disrepute to their clinic. And a doctor I spoke to, she's like, I can't have other patients coming for other kinds of healthcare and then seeing people outside. That she's like, I'm not willing to take that risk. So I hope that this legislation will perhaps provide comfort to her and other GPs that this won't be allowed to happen. And I was struck by the comment around anonymity, and I think it's such a funny idea in Ireland that anyone could possibly be anonymous in any situation. Everyone knows someone, and someone knows someone, and another person, I've spoken to a lot of people about this, spoke to me, and she was going into a hospital for completely non-related to reproductive healthcare reason, and she saw someone at a small gathering, very quiet outside, and she recognised someone in it. And she was like, oh my God, I know who that person is who was doing one of these protests. And she was like, I wasn't going in for any particular reason. I was just going into the hospital, just perfectly routine thing. She's like, and she was really struck by that. She was like, I recognise someone outside there. So of course someone at some point will recognise anyone. So and that always struck me. And as I said, she wasn't going in for any reproductive reasons, but she recognised someone outside it. So the idea of anonymity in Ireland, I think we could probably pop a pin into that because someone knows someone somewhere. So this idea that people will be able to just scootle in and out and not recognise someone outside, I'm not entirely convinced of. I'll finish up and say, of course, to thank Together for Safety, particularly Karen, Evie and Jan O'Sullivan, a colleague of mine, and all of the fellow repealers who have been working on this for a really, really long time. As we've said, this is finishing the work of the legislation that was promised 5 years ago, and it's about time. And, hurrah for that. This bill has been a long time coming, and we do need to get our act together. I was struck actually by what Senator Gavin said in terms of the timing of this piece of legislation in the new year. I hadn't even occurred to me that there's particular times of the calendar year that these protests might ramp up. So I think that's a particularly useful thing for the Minister to consider in terms of timing of getting this legislation done. I think that would be very, very welcome. We had a very clear yes vote in the referendum and a very clear promise that there would be legislation, and I'm really pleased that today we are getting it through the Seanad, and I look forward to committee stage and engaging with you, Minister, on some of the issues that Senator Gavin has raised that we think could be tightened up. But I'm thrilled that we're here. I am thrilled that we're finally getting there. Thank you.